Michael is the Roger Hertog Senior Fellow at the Council on Foreign Relations. His recent work focuses on global health and development, and that's what he's going to be speaking about today, as you know. You probably know Michael from many things, from his column in the Washington Post, from his contributions to Newsweek, and from his recent book, Heroic Conservatism. I should have a copy and hold it up here. But undoubtedly, you can find that on Amazon, and you should read it. In his spare time, Michael serves on the United States Holocaust Memorial Council and on USAID's Advisory Committee on Voluntary Foreign Aid. Before joining the CFR in 2006, Michael was a top aide to President George W. Bush, beginning as a senior policy advisor and, of course, as his chief speech writer. Michael joined the president during his campaign in 1999. Before that, Michael was a senior editor covering politics at U.S. News and World Report and served as a speechwriter and policy advisor to Jack Kemp and Bob Dole during the 1996 campaign. Michael's a graduate of Wheaton College in Illinois. I know where that is. Grew up in the St. Louis area and now lives with his wife and sons in Northern Virginia. As I said, Michael is going to speak about global health and development, prospects in a new administration, and thank you very much for coming.
Thank you very much. It's a pleasure to spend a few days here at Princeton, especially at a time when American politics is moving with such fascinating speed. One of the more interesting media moments last night happened when MSNBC's Chris Matthews was caught on his microphone as Bobby Jindal walked out to give the Republican response. Matthews was heard to moan, "Oh God." Coincidentally, this is exactly what Barack Obama thinks every time Joe Biden is about to speak. And now I do have to say, given the disaster that Jindal's speech turned out to be, this is one time I'm able to say that Chris Matthews was exactly right. This afternoon, I want to talk to you about a unique moment in the history of public health, global health, when the fight against preventable disease has never been more needed, never had more momentum, but also a time when the coalition supporting this fight could easily fragment and fail. But let me start by telling you a little bit about myself. Speechwriters are supposed to be anonymous, and at this task I've succeeded beyond my wildest dreams. As a college student, I went to Wheaton College in Wheaton, Illinois. Wheaton, as some of you may know, is a pretty religiously conservative place. No smoking, no drinking. The joke on campus when I attended was that the administration had banned premarital sex because it might lead to dancing. After spending time as a policy person on Capitol Hill, I was a senior editor at U.S. News and World Report in the spring of 1999 when I got a call from then Governor George Bush of Texas, who wanted to meet me at the J.W. Marriott Hotel in Washington, D.C. The first thing he said was, "This isn't an interview. I want you to write my announcement speech, my convention speech, and my inaugural address, and I want you to move to Austin immediately." At that time, he was not even a declared candidate, but his confidence was infectious, and so I packed up my family and went. From the beginning, we were a little bit of an odd couple. He is outgoing, social, athletic, likable, and I'm actually none of those things. I found I had little in common with the governor. He has a penchant, for example, for locker room humor that makes me uncomfortable. After one policy session at the governor's mansion, everyone had gone but me, and the governor had some time before his next appointment. He asked me, "Do you want to hang out a little while?" With a rudeness that now seems crazed, I replied, "Not really." But he put his arm around me and said, "No, you don't do that, do you?" I came to like Bush as a person and a politician. He's a man without a mask. Interest, frustration, sadness, boredom come unfiltered to his face. He is kind and loyal to those who around him. And he can be very direct and sharp-tongued. On the day of the State of the Union each year, the president sits down with all the network anchors for discussion. The late Peter Jennings once asked him, "What is it like to go before the nation and read somebody else's words?" president immediately replied, "You do it every night." The pace of those years was at times exhausting. It has a cost to your health. In December of 2004, while working on the second inaugural address, I had a heart attack. The president's doctor had me checked into the hospital under an assumed name to avoid all the press calls. Adding insult to incapacity, there wasn't a single call. And it takes its toll on your family. In the heat of the last presidential election in 2004, my little boy Nicholas, then 6, announced to me in the car that he wanted John Kerry for president. When I asked him why, he said, "So you can be home on weekends." My 9-year-old, who was a little more practical, then asked, "But how would we eat?" I told him I think I could get a job. I might work at a think tank. And he asked, of course, what's a think tank? And so I told him people who read and speak and have meetings and things. And Bucky said, and this is true, "You mean they don't do anything?" After the 2004 election, my job at the White House changed. I became a policy advisor to the president on issues such as global health and development, genocide, and areas where my interests had been leading me for many years. And I saw something very hopeful. In one of the most bitter times of partisanship in modern history, I found a number of issues where members of both parties and people of every ideology came together. I worked with conservative and liberal groups to fight global AIDS, to confront malaria, to oppose sex trafficking, to confront the crisis in Darfur. And I've seen some odd alliances grow. Over the years, I've gotten to know Bono of U2 pretty well. A couple of years ago, he invited me to my first rock concert, which was very loud. Soon afterward, my wife and I had dinner with Bono, who was a very idealistic and principled man. After dinner, my wife told me, "You may be idealistic and principled, but it would also be nice if you were rich and cool." Now I'm at a think tank, the Council on Foreign Relations, where I focus on health and development. I write a twice-weekly column for the Washington Post, where I often deal with these issues. And I believe we're living through an extraordinary period in the history of global health when a great movement came to maturity. The Bush era was often a time of exhausting controversy. It was also a time of great national generosity and creativity. Under President Bush, overseas development assistance more than doubled. Aid to Africa more than tripled. PEPFAR, the President's Emergency Plan for AIDS Relief, the President's Malaria Initiative, the Millennium Challenge Corporation. These programs represent one of the most creative periods in foreign assistance since the New Frontier, perhaps since the Marshall Plan. Their success has built a constituency in Congress that includes Democrats and Republicans, liberals and conservatives. I sat in the Oval Office and watched President Bush approve the emergency plan, the largest program to fight a single disease in human history. I sat in the Oval Office and watched the former president now approve the President's Malaria Initiative, designed to cut mortality in half in 15 highly endemic African countries. During the summer, I traveled with the One campaign that I'm involved in to Rwanda with Bill Frist and Tom Daschle and John Podesta and many others. In Rwanda 4 or 5 years ago, about 4% of people who needed ARVs got them. Today, that figure is 94%. With American help, Rwanda has cut its death rate from malaria by 2/3 in less than 2 years, mainly saving children under 5. When George W. Bush announced PEPFAR in January of 2003, there were about 50,000 people on ARVs in all of sub-Saharan Africa. Today, that figure is about 2 million. These are some of the fastest, broadest achievements in the history of public health, and they require some explanation. Inaction on global health requires no explanation. National selfishness is the natural state. Generosity must have a reason, and this reason was a remarkable confluence of events, ideas, and individuals. First, America's domestic fight against AIDS set the stage for this progress. Some expected and predicted that the AIDS crisis in the gay community would increase anger and stigma. Instead, it created a community of effective advocates in America and Europe. It showed eventual success on prevention efforts, and it got policymakers and faith leaders more accustomed to dealing with the issue. In my case, I was introduced to this crisis when my college roommate died of AIDS in the late 1980s. Many had a similar experience. Second, many started seeing firsthand the scale of the African AIDS crisis. Bono played a key role in raising awareness. Cabinet members, members of the Congress, congressional staff came back from African trips with the moral certainty that something had to be done. After traveling with Bono to Africa in 2002, Treasury Secretary Paul O'Neill, I remember, said, "If you didn't learn something, you're a piece of wood." Third, America has experienced a period of great national wealth and technological advance. Our government had large budget surpluses, and miracle combination drugs were becoming less and less costly. Initially, ARV treatments cost about $15,000 per person a year in the West. By the time of the Bush announcement, the cost was about $300 a year for generics. But in 2003, much of this was not new. There had been a surplus for many years. The problems had been evident for many years. Some principled people in the Clinton administration, such as Donna Shalala, had pushed for action, but little was done. It is an unavoidable fact that many of the top development people in America and the world were deeply skeptical of AIDS treatment. When the UN initially set out its objectives on AIDS, the United States fought against the inclusion of aggressive treatment goals. There was no consensus for ARV treatment. In fact, many adopted a prevention-only approach. And I believe in many cases, this went back to a destructive belief that Africans could not manage a chronic care delivery system. There were hints of change on the priority of treatment at the International AIDS meeting in Durban in 2000. The discourse among AIDS experts began to shift from whether to do treatment to how to do treatment. But the biggest source of momentum for treatment came within the Bush administration. And it involved a fundamental shift in development theory, a change in vision, which came to be known as the Monterey Consensus. Bush was willing to dramatically increase foreign assistance to nations that themselves were willing to work as responsible partners, dedicated to reform and transparency. The model was partnership, not paternalism, and it involved trusting local people, including African health leaders. History is pushed by large economic and technological trends, but its shape is ultimately determined by a leader in a meeting in a room with coffee cups around a table. In the Oval Office meeting where PEPFAR was debated, there was an extensive discussion about treatment. Could the money be better spent on other, more effective goals? At one point, National Security Advisor Condi Rice spoke up and talked about her own mother, who was diagnosed with cancer when she was a teenager, but lived on cancer treatment until Condi was 30 years old. She said in that meeting, "You bet those years meant something to me, and they would mean something to every African child whose mother lives to take care of them." Ultimately, President Bush believed that Africans were capable of large-scale treatment with large-scale outside help, and that treatment was essential to the stability of whole societies. He bet $15 billion on this belief, and it has been generally justified. 5 years into this noble experiment, some lessons, I think, are clear. We've learned that the initial focus on AIDS, rather than health infrastructure or other important priorities, was essential, even unavoidable. AIDS is sometimes viewed as a disease of the poorest. It is not. It takes doctors and lawyers and nurses and factory workers and civil servants, the very people who make organized society possible. You see the radiating effects in the health sector, where one of the main problems is not brain drain, but death. In some places in Africa, HIV infections among health workers are twice as high as the general population. You see this effect in education. Among the 13 million AIDS orphans who are left with no resources and little motivation to attend school, and among teachers. In Zambia, according to one report, 2 teachers die for every one that graduates from educational training school. You see the effect on child and maternal health, not only in mother-to-child transmission, but also because children with sick or dead parents have higher mortality rates. Untreated parents are less likely to provide care and more likely to carry infections. I remember speaking with an American physician in Zambia who had begun doing treatment in around 2000. When he moved to Lusaka, his daughter attended a school across town. Each school day, he would have to leave about an hour early to navigate through traffic jams because of the constant funeral processions. No society can long survive in the shadow of death. I'll put this bluntly. AIDS relief is more expensive than some other important health and development interventions. But it doesn't matter what Millennium Development Goals you adopt on education. If teachers are dying, those goals will not be met. It matters little what health infrastructure or maternal health goals you adopt if parents and nurses are dying and societies are collapsing under the weight of despair. Those goals will not be met. Another lesson we learned is that measured outcome goals matter. In older approaches to development, results had little role. American assistance during the Cold War was often used to reward loyalty. European assistance to former colonies was often used to assuage guilt. Most people, frankly, viewed developing nations as basket cases that could not be expected to make much progress anyway. But an orientation toward results, accountability, and partnership breaks that pattern. The best African leaders understand that expectations are a form of respect, expectations that help them transform their own nations. We've learned that scale matters, that boldness matters. A scattering of pilot projects changes little. They're often run from the outside. PEPFAR and PMI took a different approach, national scale-up with countrywide plans. This demands real development, the creation of supply systems and human resource systems and management systems, the kind of accountability and transparency and professionalism that can bleed through the entire health system and beyond. We learned that effective aid, like an effective military, requires the integration of efforts in a central command structure. This has been the positive role of presidential initiatives in global health. Before PEPFAR, some people working on AIDS in a country from USAID, for example, literally did not know their counterparts from CDC. We could not accurately tell the countries themselves what we were doing in their countries. American efforts were often diffuse, unstrategic, and messy. Given the urgency of the AIDS crisis, we did not have time to reform USAID in the traditional way. That remains to be done. But PEPFAR was a kind of ad hoc foreign assistance reform, focusing attention, resources, and personnel on a coordinated effort with measured results. This is the way most foreign assistance should work. We learned that American leadership on global health is indispensable. If we fail to take the lead, others do not take up the slack. In 2007, America contributed about 40% of the entire global AIDS effort, and that is increasing because our partners generally increase at a much lower rate. Multilateral efforts such as the Global Fund, which were founded during the Bush years, are important, but little gets done without American leadership, often bilateral leadership. And we learned that for development assistance to be broadly supported and aggressively funded, some political and moral arguments must be suspended, particularly arguments on abortion and comprehensive family planning. The coalition that achieved the AIDS bill initially and achieved the reauthorization last year, included both the health community and the religious conservative community. But this was only achieved because certain topics were avoided. So progress has been unprecedented. We've learned a great deal in a short time. The new president has promised to continue this momentum and double foreign assistance once again. But the needs, of course, are great and growing. The rate of new HIV infections is making the goal of universal treatment more distant rather than closer. In 2005, there were 4 million new infections, far outpacing the growth of treatment. Clearly, in the absence of a vaccine, a new generation of resources and innovation on prevention will be necessary, and maternal health and health infrastructure and women's justice and empowerment and long-term economic development, these will all need to be priorities. But at the same time, a variety of factors seem to be undermining the priority and appeal of global health spending. President Obama faces a crisis of competing priorities. He is required to spend a great deal on bailouts and stimulus. He intends to spend a great deal on health care and new energy technologies. In a nation turning inward, it will be very easy for foreign assistance to lose a Darwinian struggle for dollars. Even before the election, both Obama and Biden began retreating from the timetable to double foreign assistance. The 2010 budget, at least from the hints that I hear so far, contains about a $3 billion increase for the 150 account, which is foreign aid account. But most of this will go to the State Department operations. In reality, most global health spending will be flatlined next year or maybe increase a bit. I have deep fears, in addition, about the direction of Republican ideology. In this economic environment, and without President Bush, it will be easy for Republicans to return to an anti-government default position on foreign assistance and adopt a kind of moral isolationism. And we are seeing at the edges the decay of the ideological coalition that produced PEPFAR. The sudden firing of Mark Dybul, the PEPFAR coordinator, after the administration had initially asked him to stay on for a transition period, was a bad sign. It was clearly done at the insistence of some very ideological reproductive rights groups that want PEPFAR to emphasize comprehensive family planning more. Whatever your view on this specific issue, that kind of change would destroy the alliance that has sustained and expanded PEPFAR in last year's reauthorization. If the Democratic Congress wants to expand family planning, it should expand the family planning budget. If it wants to turn AIDS relief into a comprehensive family planning program, it will end Republican support of that program. If it undermines the abortion restrictions of Kemp-Kasten or the Helms Amendment, it will turn Republicans against foreign assistance entirely and make a fragile success into a battlefield. So how do we respond to these challenges and get through this period of economic emergency and tight resources? How do we navigate this storm? Let me leave you with just a few thoughts. First, there's an intellectual task: to assert robust foreign assistance as a centerpiece of American foreign policy. While the political consensus for foreign assistance is fragile in America, the intellectual consensus is actually strong and bipartisan. Conservatives and liberal thinkers, realists and idealists, generally understand that the worst challenges of our world, terrorism, drug trafficking, human trafficking, criminal gangs, refugees, pandemics, emerge from weak states, ungoverned regions, and hopeless parts of the planet. And by encouraging hope and progress and health and good government, we add to the security of America. A world of misery is a world of danger. A world of hope and progress tends toward peace and stability. This consensus is embraced by leaders from Colin Powell to Bill Frist to Henry Kissinger to Secretary Robert Gates, who has called for, quote, a dramatic increase in our civilian instruments of national security. It is General Petraeus who insists the human terrain is the decisive terrain. Fascinating recent poll found that 84% of post-9/11 military officers believe that strengthening development and diplomacy is equally important to our national security as improving our military capabilities. Second, we need to respect and maintain this unlikely coalition between religiously informed conservatives and the more liberal health community for the sake of the most vulnerable people in the world. Third, Americans themselves need to get involved. African leaders have very little access and influence in the Congress, and moral causes matter little to that body unless they are embodied in a political movement. So, join the One campaign. Be an activist. Make the moral and foreign policy case on campus. This is a cause that will justify all of your effort and idealism. In bad economic times, foreign assistance can seem expendable. In fact, it is a priority. In times of economic crisis, the needs of nations on the edge are greater, not less. The needs of the bottom billion are greater, not less. We need to be clear with one message. The good economic times may have ended, but our moral commitment to the poor and suffering has not ended. Finally, and most importantly, Americans need to hear the stories of success. Many citizens, in my experience, have never heard a success story with foreign assistance money. They think it is thrown down a rat hole of corruption and waste, but it is not. It is working miracles, and Americans should know of it and be proud of it. I think that pride is justified. But my greatest lesson learned in the developing world was different than what I expected. Instead of being proud of American achievements, I have often been shamed by the courage and faith of the people I have met. I expected to feel pity. Instead, I have felt awe at a spiritual maturity beyond anything I could imagine. So let me conclude with a story that moved me. A few years ago, I was in Kampala, Uganda, in a refugee community on the side of a steep hill. 90% of the residents are women or children, refugees from up north, where the Lord's Resistance Army had killed large numbers of the men. Many of the women were HIV positive and had terrible stories of suffering. A young woman I met had been abducted by the LRA along with other members of her village. She calmly described their first night's, quote, welcoming meal, in which one of the villagers was killed and the rest forced to eat them to instill a proper fear. Many of the younger boys had been kidnapped by the LRA and trained as soldiers, forced, I was told, to do terrible things such as cannibalism and murdering their neighbors in their home village so they could never return. One of the former child soldiers I met was maybe 16 or 17 years old at the time when the leader of the LRA, a messianic madman named Joseph Kony, visited his prisoners. All were forced to prostrate themselves. But this young man looked up in curiosity, and they took out one of his eyes in punishment. At the center of this settlement is a steep-walled open-pit mine. Brush is pushed against the walls and set on fire to remove water from the rock and cause it to crumble, leaving a permanent haze in the air. The women of the village support themselves by breaking rocks from the pit into gravel with small metal hammers for several hours a day. After Hurricane Katrina on America's Gulf Coast, these women, many of them HIV positive, somehow collected $1,000 and sent it to the American Embassy to help with relief efforts. When I thanked them on behalf of our government, I have never seen a group of people more proud of themselves. I was told, we are the donors now. Generosity of the poor turns out to be more impressive than anything we give them. We should be honored to help them and humble enough to learn from them. Thank you very much. Please. Anybody?
I have first a comment and then a question. The comment is just in regards to development in general. I recognize how a lot of U.S. taxpayer money goes into the developing countries, and I've seen the miracles, like you say, that indeed take place. On the other hand, as a student of development, I also think that it's important for us to still have some level of skepticism And I say that because coming from a developing country, I have witnessed how some of the foreign aid, or a lot of it actually, does come back to the U.S. And I've also seen how sometimes through maybe, let's say, USAID-funded projects, the U.S. government has a hidden agenda, and they try to push their agenda to a country's political spheres. So, in general, I just feel like we still, in an effort to make aid more effective, I still feel like we should all still have, or I at least personally have a level of skepticism in terms of how effective all of this aid has actually been in the past. That was a comment. And now,
Yeah, go ahead.
you can respond to it as now for the comment, the question. In terms of the Millennium Challenge Corporation, I guess it's a two-part question. One is, what do you think will happen now with the Obama administration? I believe the funding has now decreased for the MCC. And the other one is more related to global health. How do you think that the MCC is actually shaping the global health agenda?
They're both good comments and questions. I'm not sure I expected to come to, as a conservative, to Princeton University to defend foreign assistance against your skepticism, but I'm happy to do so. The reality is that, and I mean you know the literature as well as I do, that when you're talking about long-term economic development, the correlation for the last 40, 60 years between aid inputs and measured outputs, when you're GDP and all those sort of things, is not very close. Aid has been done for a variety of reasons, but development has often not been the top priority. If you look at our current budget, a large portion of our aid budget goes to a country like Egypt, which is a payoff for the Camp David Accord that has had almost nothing to do with outcomes for the Egyptian people. So it's hard to deny your basic premise that much foreign aid is problematic in that way, that it serves a series of political goals that have nothing to do with kind of welfare, including increasing health outcomes and all those sort of things. Now, some of that, of course, is justified. We do military assistance and technical assistance and a lot of other things for reasons that have to do with the national interest. I don't deny that that's a priority. We sometimes do food aid, which we specialize in as the United States, with no hope that it's going to have long-term consequences. It just meets a short-term humanitarian need. That's fine too. It's the outcome is saving lives immediately. That's fine. But this was the effort that was launched, at Monterey, to try to reimagine the way foreign assistance is done, to reorganize the U.S. effort, and to reimagine the relationship between donors and recipients. Okay, that's why I think MCC was an important kind of ideological milestone here. It said that we're going to work with countries that move towards good government and develop their own approaches and plans and show, transparency and work on the rule of law and the rights of women and some of the other basic indicators that they set out, and that this will leverage aid to be more effective. My concern about the MCC was that it got a very slow start and squandered a great deal of its political capital. Unlike Randy Tobias at PEPFAR, that had the attitude and strategy he called ready, fire, aim. Okay, they were an emergency. They went in, and this guy I talked to that I mentioned in the speech in Zambia, they got a call from the U.S. government in 2003 that said, "We want you to get, I forget what the exact figure was, but tens of thousands of people on treatment in just your program, and we want it in 6 months." They didn't have any space. They set up tents to take in people. They did, I forget exactly what he called it, but they They had nurses serve the role of doctors. They had volunteers serve the role of nurses. They had patients serve the role of volunteers, okay, just to get things out the door and start people on treatment, show outcomes and results. I think it was, there's waste in any, whenever you spend $15 billion, there's waste, and there were problems of implementation, and people complained about reporting requirements, and there were all these sort of things. But the reality is they got a lot of people on treatment quickly, and it created the sustainable political momentum for that program because it was outcome-oriented. And when the Congress reauthorized last year, it was massively increased, in a time of tough budgets. MCC was almost exactly the opposite. It had a few problems. It had leadership problems because the Millennium Challenge Corporation tried to do things itself. PEPFAR went in and stepped on a lot of toes, but took the resources from USAID and CDC and a lot of other people and directed them under the guidance of the ambassador, who had never been involved in this stuff before, and made it work with an outcome basis. MCC tried to go and do it itself with a very small staff based in Washington, D.C. And Andy Card, who was the chief of staff, actually sent me at one point to Mozambique to talk with their negotiating team, their MCC negotiating team, the Mozambique side, the businessmen and others, the government officials that were involved there. And they were deeply frustrated for a couple of reasons. MCC took a serial approach to the compacts, okay? So they didn't hear from them for months, and the feedback was poor, and they only got periodic focus because of those constraints. I won't go into all the details, but the initial director of the MCC had a mania for what was called country ownership, okay, which is great in theory, and it fits some of these approaches. But the way it was interpreted when I talked with these people from Mozambique is that they would get MCC come back and say, these development proposals are not acceptable. And they'd say, okay, well, can you give us some guidance? And the response would be, no, we can't give you any guidance because of country ownership. You have to guess. So there was a kind of a poor implementation of theory in this. Now, I think that Ambassador Danilovich changed things significantly when he came in, got a lot more money out the door, got compacts, out. And the great thing about MCC, and the reason it's promising, even though it got a slow start, was that it actually did result in a kind of competition between countries for large grants, and it led to changed behavior. There were African cases where they changed their laws to strengthen, the property rights of women in order to qualify for the MCC. It was very effective. Danilovich tells the story, which I think is a good one, that after Daniel Ortega took back power in Nicaragua, and relations between our countries deteriorated once again because of their background and ideology, Ortega actually called Danilovich and had him come down and said, we love MCC. We want to increase our compact next time around. And it was a source of continuity in the relationship, a long-term continuity in that foreign policy relationship that I think probably served American interests in the long run. Okay. Those are all I'll give you one more example, because I met with I think it was the finance minister from Malawi. They faced a huge food challenge, and they were, applying to be a threshold country, which was a good idea to prepare them for a compact. They had great immediate emergency needs on kind of the farming side and food security and all sorts of terrible problems, which shouldn't be. Malawi has huge lakes. It just doesn't have, distribution systems and things. But they came to ask for money to strengthen their business court system. because they knew that was going to be the key to long-term development, and it was the best way for them to compete for the MCC funds. I thought it was kind of an interesting way to approach things. So I've seen, I think it's I think it's many ways on long-term development assistance the way to go. It faces a couple of problems. It faces a political problem because we have no idea how successful it is for 10 years, okay? Unlike putting people on ARVs or doing, bed nets and malaria treatments. And it makes that's just a much harder political sell in any environment. Okay? It's easier to vote for health policy outcomes than to support long-term development assistance that has a poor track record, even if you've got a different theory. Okay? Some of it is it's identified as a Bush-era program. I think there are some problems there. But from what I heard last, there's a significant amount of money for MCC in the 2010 budget. It has a tougher time on the Hill. I think Leahy's proposals are, I'm trying to remember, they're very low. And it would be a real, I think it would be a real shame. I mean, it would cut off a source of innovation, and it caused some waves, but it was I think it at least attempted to be an answer to the initial question that you raised, and a recognition, and I've talked with people at USAID about this, that this is the kind of long-term development, the only kind of long-term development that may get sustained political support in the American system, because it is outcome-oriented and it has standards and it promises something different. So that's a long answer to a short question. So.
I'm from one of those countries that are supposed to have good governance, right. And I'd like you to.
Where are you from? I'm sorry.
I'm from Botswana.
Okay. Mm-hmm.
And I'd like to know if there's an example of a country that you deem as having been successful, mm-hmm. particularly with regard to the HIV/AIDS challenge. Mm-hmm. I know that Botswana had a very good health infrastructure at the beginning. That was one of our priorities. And over the, maybe even in just the last 5 years, we've had all kinds of movement between U.S. NGOs, U.S. Health sector NGOs in Botswana. Mm-hmm. And sometimes I wonder whether those partnerships actually make a difference. The one thing that alarmed me was reading recently that Botswana is going back to the World Bank for more loans because the HIV/AIDS pandemic has not abated. So my question is, have you come across any place, particularly in those critical countries, where you might say there has been some success?
Yes. I think you're pointing out something. I haven't been to Botswana in a while, but I think you're pointing out a reality that's a difficult one in many ways to explain. I'm sorry, I should not have done that. A lot of the success that has been seen on infection rates, new infection rates, has not been in Southern Africa. It's happened in places like Kenya, Uganda, Rwanda. I've talked with Kenyan health officials. They've had, some fairly steep reductions in new infection rates. And you ask them why, they're not quite sure. They've actually seen reductions in, they've seen the delayed onset of sexual activity, particularly among girls, okay, which is a good thing and actually has a big epidemiological effect. They've seen a reduction in multiple concurrent partners. They've seen an increase in condom use in high-risk sexual activities. They've actually seen a decrease in polygamous marriage, which they can't explain. Okay. So it seems like the progress is spread out in a variety of different areas, and there are some countries where that's happening. In places like Botswana and South Africa and other places, you've seen, hyper levels of infection that haven't gone down very much. And there's a huge amount of debate on why, this is, and I'm not, an expert on the epidemiology of AIDS, and there's a huge amount of debate. There's even some debate now of whether it might have to do, it may have something to do with this issue of multiple concurrent partners, which drives so much of the disease, but it could also have something to do with the level of circumcision, which is just a fascinating new kind of.
But then that's not even in my culture. We don't even have any practices like that.
I know. But that's the challenge. Okay, circumcision seems to provide a fairly dramatic protection against the disease, and in parts of Africa where you see infection rates, you often see that there isn't, that this doesn't take place. That, of course, creates a mass of cultural problems and, all sorts of things, religious objections, and, it's very, very complicated. So I think, in a very simplistic way, what you've seen in some areas is a success on treatment levels, but not on infection rates. Okay, and I think a lot of Southern Africa falls into that category. You have, though, there are examples where you've seen success both on treatment rates and on new infections. Okay, which is the hope, because you're not going to treat your way out of this infection eventually. Okay? There's just no way to do it. It's a massive expenditure. You eventually have to get these rates down. So I think your instinct is right. It's variable, and it's unfortunate that a lot of that's true. Now, I think some of this, people try to trace some of it to government leadership, but Botswana is a pretty well-run country. They don't have a lot of the corruption problems that a lot of other places do. I think you can definitely trace some of the problems in South Africa to poor global health leadership, denial of the disease, and deep political problems when it comes to these things, which are improving. So I guess the answer is, and I wish I had a better one, is that yes, in some places you have seen fairly dramatic reductions in infection rates, but in others you haven't, and it's hard to explain why. So.
Hi.
Sure.
My question actually relates exactly to what you were just talking about the fact that infection rates have increased while treatment has increased at a lesser rate.
Right.
Would you say that, what does this mean for our priorities in terms of prioritizing prevention versus the actual treatment? And do you think that's important to have education about how the virus is transmitted, and what that means for also including abstinence and non-abstinence programs?
Well, let me respond to that in a couple of ways. First, some of the distinction between prevention and treatment is artificial. Okay, there is a minimal level. There is a certain level of treatment you need to do to have any prevention, in my view, because people who have no hope of treatment are not going to get tested. That was the dynamic in a lot of places. If this is a death sentence, if your prospects of treatment are low, then it makes no psychological sense to get to know your status, and then that's the key to all prevention. Okay? So I've been in Ethiopia where and saw the effect that treatment can have. I was brought to a prevention counseling center where they said, well, do you want to meet with this woman with a translator? And I agreed to do it. But then I really regretted it because she had not received a result. She was waiting for her results. And I thought, well, I told her I don't need to talk to you. And she said, no, it's okay. She said, a year and a half ago, I would have never talked to a foreigner about AIDS and would have never gotten tested because it was a death sentence. There was no possibility of doing anything about it. She said, but now I have 3 friends who have been tested, and one of them is on treatment. And that's why I'm here today. I'm willing to talk to you. So there's an effect on prevention, and there's effect on stigma. I mean, the stigma is much worse without treatment. Okay? So there's a dynamic relationship between them that I think you need to say, and then you need to recognize. Going back to the types of prevention. I mean, some types of prevention are, it's a broad category. There's a lot of things you can, initially a lot of PEPFAR and other things, we're focused on blood supply, tainted blood supply. That's a form of prevention. Okay, that's some mother-to-child transmission, which is one, which is still massive all across Africa, and and the success rates on preventing mother-to-child transmission are just huge. I mean, they're 90-some% success rates. So that's a form of prevention we could spend a lot more time on and do a lot more on. I mentioned circumcision because people are starting to view this as kind of a form of prevention as well, even though it has so many problems. But just going back to that Kenya example, and what I found on the ground in a lot of places, is that some of these culture war arguments that we have in the United States have little relevance to the realities on the ground. So when I talk to people at clinics, I mean, there are exceptions, but you talk to people at clinics, and their response is, we have to delay the onset of sexual activity for young girls to protect them. That's an important thing, okay? That's a type of prevention that's different than handing out condoms. It requires a kind of, not necessarily religious appeal, but a kind of, a self-respect appeal among girls. And so, that's important. There are, in some places, you go to Uganda and other places, because of this problem of multiple concurrent partners, because men have multiple partners and bring it into married relationships and infect women, okay? The B in ABC, abstinence, be faithful, and condoms. The B is a feminist issue. Okay, it's convincing men not to bring the disease into the home and infecting innocent women. Okay, and they've had some success on these efforts, but it's the reason that their I think rate recently has gone up a little bit because you've seen some of that. And then you talk to people, and even the most conservative religious people who do these sort of things, when I've asked, I remember asking in South Africa a pastor that would be considered a complete fundamentalist in the United States, and asking him, how do you approach this issue? And they said, well, we try to teach young girls that marital faithfulness is a key to their self-respect and dignity. And we work with prostitutes and we give them condoms. Okay? Because the best approaches to these issues, the reason so many of these efforts are successful, is because they treat individuals as individuals, not as categories. So you're talking to an 11-year-old girl, you have a different message than when you're talking to a 19-year-old boy. You have a different message than when you're talking to a prostitute. And you need an approach that allows this sort of thing, instead of, I think, making one-size-fit-all arguments on these things. So the reality is that PEPFAR, as it's scaled up, I think in its first 5 years, the 5 years in the emergency plan, handed out over 2 billion condoms. Okay? In the first couple of years, it was a 70% increase in condom distribution. Okay? Now, you'd expect that because you're scaling up these health efforts and other things. And I even sense among Roman Catholic leaders that I talk to in Africa, first they look the other way. They completely look the other way when it comes to discordant couples. Okay? You can't expect people not to have sex within marriage. And when you have one positive and one negative, condoms are the an approach, and that's necessary. So the kind of pure arguments on either side just don't fit my experience very well when I look at these things. Now, the argument about PEPFAR was really the set-asides on abstinence, okay, and faithfulness. they were, they were controversial. In many ways, they were corrective because USAID had traditionally not given money to a lot of these programs. But I guess I would conclude that, the ABC approach, which was really the approach developed by Uganda when their initial response to the AIDS crisis, which I think had a real effect on infection rates and prevention, and provided some hope to everybody that this might be possible. It is, in many ways, the kind of authentic African approach. It's the one they developed, and it genuinely has an emphasis on all three of them. So I just, I don't think we should. There's sometimes on the right an ideological approach to family planning, either in the Catholic community or strong conservative Protestant communities, that's not realistic about human nature. And on the left, there's sometimes, I think, a sort of cultural imperialism. That we don't accept your approach, which includes values and faithfulness. Okay? When in fact there's some good evidence that these things are important. So that's just my basic.
Yeah, let's great. So speaking of right and left, my question actually doesn't have to do with health or development. But since we have you here, I'm hoping you can give us your impressions of Obama's speech last night as one of the most masterful speechwriters in America. I'd love to hear what you thought. And then you mentioned Bobby Jindal's response. I wonder what he didn't say that you wish he had, or what lines of attack he didn't open up that you wish he had used.
I thought that Obama's speech last night, first of all, an economic speech is one of the hardest speeches to write of any speech that you do. There's a natural drama in speeches of war and peace and speeches of civil rights and, other things. He had it was a difficult task to be talking about shoring up credit markets and, laying fiber optic cable and doing, whatever he wants to do. And so I thought that he had a difficult task. But I don't think it's an exaggeration to say that the speech was Rooseveltian in a certain way. Roosevelt was the master of simple, explanatory language. And I thought the speech succeeded from that perspective last night. It had a tight, clear outline, dealt point by point, dealt with possible objections, answered them. The language was simple but not simplistic. It didn't speak down to people. His delivery, as usual, was fluent and confident. And so I was deeply impressed. My problem with Jindal's speech was exactly the opposite. He spoke in a simplistic, sing-song language that was insulting in a certain way to people who were listening. It was not simple; it was simplistic, and the tone of it was some had some odd Mr. Rogers tone to it. That I had seen Bobby Jindal the day before. I was in a small meeting with him. He is a very smart policy wonk. The speech that he gave, in the small group that I was in, was rapid-fire, detail-oriented policy speech. Okay. And was impressive. It was not inspiring, but it was informational, impressive, and interesting. But I've seen that before, where somebody stares into a camera and becomes something completely different and not very likable. And it's a bad sign. So I think last night was Tuesday night was last night, right? I was up late. It was a good night for Barack Obama and a good night for Sarah Palin.
I'm wondering if you could comment about the Americans' tendency to believe that we give a lot more in foreign assistance than we really do, and how, and it seems to me one of the problems with, one of the obstacles to increasing foreign assistance, whether it's health-related or not, or PEPFAR or not, is that Americans believe that we give something like 10% of our GDP to other countries, when in fact it's less than half of 1%. Right. And why Americans believe that, and how to go about changing them, if that's an obstacle that you also.
Well, I mean, your observation, according to the data, is exactly right. Okay, I mean, people believe that our commitment is much larger. They generally think that foreign assistance is ineffective, and the question is why they think that. You know, I guess that's a good question. I'm not sure that I've ever seen a compelling kind of polling analysis of it. I have seen, though, the breakout on support for foreign assistance, you know, that Gates and others have done. And it's an interesting picture because both parties are divided. Right? In the Democratic Party, people that are open to spending on foreign assistance tend to be college-educated Democrats, higher education level Democrats. The people that are most hostile in that coalition are more blue-collar Democrats who want first dollar spending to go on health care and benefits and a variety of other things. The Republican side is rather interesting, too, because the most hostile of any group are, in fact, libertarian or free market conservatives who I think have ideological objections to, in a variety of ways. The most open are religious conservatives. They're more open to arguments about America's moral role in the world, about the need for America to provide a moral example, and things like this. They are still skeptical that government is effective in doing that. Okay? Much more skeptical than on the Democratic side. So, I mean, one of the things that various groups have been trying to make clear to people in trying to build this coalition is to try to make clear on the Republican side how much of foreign assistance goes through, and has always gone through, faith-based institutions and organizations and private institutions, rather than being directly government provided. People don't know that either. But that actually helps on the Republican side to say it's not just the government spending this money. It's actually going through, private and faith-based institutions when it does this. I think there's the polling also indicates, though, at least what I saw last year, because we did a lot of this in the one campaign and trying to influence the grassroots element of the campaign, is that when you try to tell people about the actual amounts that we put to foreign aid, they're not particularly receptive, even when they know. Okay? And maybe that's a problem with an orientation towards inputs. So, for example, when we did the focus groups and all this sort of thing, and tested the argument, America should give 1%, which is the one campaign kind of thing, 1% of GDP to foreign assistance. Everyone hated it, okay, because it was input-oriented, okay. It's like you're trying to make you feel guilty. You're not giving what the Europeans give, okay, and it was deeply unpopular. But if you tell them stories of success and, that's why what I talked about, kind of the need for Americans to at least hear some story of foreign, the success of foreign assistance, that tends to be more appealing to people. So it's a conflict in a certain way because these Europeans are very oriented towards inputs and very proud of what they do. But it just doesn't communicate very well in American politics. And a kind of a guilt message doesn't work particularly well.
Michael, you quoted a figure, I think referring to retired military officers, the 84%
Right.
thought that spending on defence was as important as spending on foreign aid. If you look at the US budget, obviously,
Yeah.
there's 4% on defence and about 0.16% on aid. And I guess if you take the military officers seriously, that looks slightly out of whack. So do you think it would improve the security of the US if it cut its military spending and spent more on aid, or is that some sort of utopian dream?
Well, I'm all for more foreign assistance. The question is whether you do a direct trade-off with the military. It's interesting that you'll find that out of necessity, the Defense Department actually does a significant amount of development spending now, okay, because of the problems that they face in a variety of settings. It's one thing that has been interesting, particularly about the last several years. And so that's in a certain way a recognition internally within the Defense Department that they can't just fight with traditional tools. It is, by the way, one of the major tenets of the changes of military doctrine that took place between the kind of Rumsfeld era and the Gates era with the coin, counterinsurgency approach. That's why I think you see these effects in the polling, because officers are now being trained in the importance of soft power in these settings, and it's because Petraeus wrote the book, on counterinsurgency, and it's a huge revolution going on. The question is whether, so you've actually had people rumbling about, well, maybe we should actually have the equivalent, more of the equivalent of, like the British Imperial Service kind of approach, where we actually have a dedicated agency that might do nation building and, kind of all these things that are now divided between, the Department of Defense and, 12 other agencies. It's not a unified sort of approach. That's been part of the foreign assistance reform argument. Do you create a super empowered USAID? Do you do a cabinet level official that kind of does these things? That takes seriously both the kind of strategic vision and humanitarian concerns. So I don't know. I mean, I guess I'm attracted to foreign service reform that that gives somebody the lead, okay? And the authority to make things happen and goal-oriented objectives. And then the comparison really is the military in a certain way, because we went through that revolution of centralizing the military command structure after it had been deeply divided between the services, and the individual groups kept their identities, Navy, Marines, and other things, but they accepted the role of strategic planning from the Joint Chiefs Staff. We have nothing comparable to that in aid, as far as I can tell. When we, just to use a minor example, when we were looking at democracy assistance aid, I remember the National Security Council asked for an analysis from the State Department on all of the democracy assistance, that we were providing. And it came a year and a half later, and it was divided between a dozen departments, and most of it had nothing to do with democracy. It was just accounting. Okay. You look at the lines on it. And so I think there is a huge problem about coordinating these efforts in a strategic and effective way. And so right now, DoD does take a portion of that job, and so does USAID, and so does HHS, and so so do a lot of people. Would that be better served in some other context? It might be. This is, I know, controversial, but I found, I think that there was a significant. I think one of the large mistakes after 9/11 was not increasing the size of the military enough. it led to a circumstance where the current military has been deeply strained, and Obama, you'll notice in his speech last night, talked about expanding the size of the military, and that's I think there's some consensus on that too, given an expansive set of responsibilities that they're heavily overstrained.
One more last question.
What have been the effects of PEPFAR and PMI on diplomacy and administration abroad?
Well, it's hard to do a direct correlation. It's a fact in the Pew Global Attitudes surveys that where America is popular, it is most popular in Africa. Okay, I think 7 out of the top 10 countries with a good view of America, with the highest view of America, are African countries. Now, I think PEPFAR's contributed to that. It didn't create it. America's always been fairly popular as an aspiration, as an ideal in Africa. There are 2 countries on that list. I can't remember which 2, which I thought was fascinating, that where America is more popular, people have a more positive image of America than Americans do. So I think that we've done a lot of things right in public diplomacy as it relates to Africa, and I think that these initiatives have helped, contribute to that, but not create it. Is I guess the way that I would approach that. Africa, though, does present a number of challenges on that front as well. I mean, a kind of growing conflict between Muslims and Christians along the band in Central Africa is going to be a big deal for America. It's a big deal in Somalia. There are problems in Somalia, but big deal in Nigeria and other places. It's going to, we face a lot of challenges there. But I've had the experience of meeting with African leaders who are genuinely grateful, have a very high view of America. It's not a coincidence that one of George Bush's last foreign trips was an extended African trip, because they like him there. And he's very popular in Tanzania, very popular in a lot of other places. So I do think that's it's played an important role. But I also believe that Barack Obama has a unique opportunity to expand that, if he'll take advantage of it and not be hesitant about it. It is just an amazing thing that the President of the United States has a stepbrother in Kenya. It is a huge public diplomacy advantage, and I know that he'll have advisors that tell him, don't press that advantage, it identifies you too narrowly, or other things like that. He should not listen to any of them. This is a real historic opportunity in Africa and America, the relationships between America and Africa. With the structures of PMI and PEPFAR in place, and now a president that is wildly popular on the continent, and the increasing strategic importance of Africa from a variety of perspectives, resources and conflict issues and a lot of other things, that this should be a great moment. I mean, it should be a great moment for America.